Have you ever wondered why menstrual health is so important? Well, let's break it down together. You see, menstrual health is a crucial part of every woman's life. It's more than just a monthly cycle. It's a barometer of overall health and wellness. It can impact everything from mood and energy levels to physical comfort and even fertility. This isn't just a women's issue either. Menstrual health is a topic everyone should be educated about because it can affect relationships, work dynamics, and societal attitudes. It's a conversation we all need to have, and that's why we're here today. Our aim with this video is to shed light on menstrual health, discuss common issues that women face, and talk about the importance of menstrual hygiene. You see, knowledge is power, and it's our hope that through understanding, we can contribute to a healthier, more empathetic society. Stick around, and let's dive into the world of menstrual health. What exactly is menstruation? You may have heard this term before, and it's a fundamental part of reproductive health, but let's dive a little deeper into what it all means. Menstruation, or as it's often referred to, a period, is a normal biological process that most women and people assigned female at birth go through. It's a monthly cycle that prepares the body for the possibility of pregnancy. So, how does this process work? Let's break it down. The menstrual cycle, which usually lasts about 28 days but can vary from person to person, is a series of changes that the female body goes through. This cycle is divided into 4 main stages: menstruation, the follicular phase, ovulation, and the luteal phase. During menstruation, the body sheds the lining of the uterus, which is released through the vagina. This is the part of the cycle that we often refer to as a period. The follicular phase follows menstruation. During this time, the body prepares for ovulation by developing follicles in the ovaries, which contain eggs. Ovulation is the next phase, where one of the ovaries releases an egg. If this egg is fertilized by sperm, it can lead to pregnancy. Finally, the luteal phase is where the body prepares the uterus to receive the fertilized egg. If the egg isn't fertilized, the cycle ends, and menstruation begins again. Now let's talk about hormones. They play a vital role in this process. 2 key hormones, estrogen and progesterone, control the menstrual cycle. They regulate the thickening of the uterus lining and the release of the egg during ovulation. Remember, menstruation is a normal part of life. It's a key indicator of reproductive health and absolutely nothing to be ashamed of. Understanding our bodies helps us to navigate our health more effectively and to recognize when something might not be right. So now that we understand what menstruation is, let's look at some common menstrual problems. What are some common issues women face during their menstrual cycle? Well, let's dive right into it, shall we? To start with, we have premenstrual syndrome, or PMS. Most women experience some form of PMS, and it often includes symptoms such as mood swings, bloating, headaches, and fatigue. These discomforts typically occur in the week or 2 leading up to a woman's period. PMS is likely caused by fluctuations in hormone levels, although the exact cause is still not fully understood. Next up, we have heavy bleeding, also known as menorrhagia. This is a menstrual period that is unusually heavy or lasts longer than normal. It can be caused by a variety of factors, including hormonal imbalances, fibroids, or other medical conditions. It's important to note that what's considered heavy can vary from person to person. If you're going through multiple pads or tampons in an hour, or if your period lasts more than 7 days, it might be time to consult a healthcare professional. Then, there's the issue of irregular periods. This can mean periods that come too frequently, not frequently enough, or skip months altogether. Irregular periods can be caused by numerous factors, such as stress, changes in weight, or certain medical conditions like polycystic ovary syndrome. Lastly, let's talk about dysmenorrhea, which is just a fancy term for painful periods. Many women experience some degree of cramping during their period, but for some, the pain can be severe and debilitating. This can be due to conditions like endometriosis or uterine fibroids. So, those are some of the common menstrual problems that women may encounter. It's important to remember that while these issues can be distressing, most of them are treatable. If you're experiencing any of these symptoms and they're interfering with your daily life, it's always a good idea to reach out to a healthcare professional. There's no need to suffer in silence. Remember, your health is important, and taking care of it is one of the best things you can do for yourself. These issues can be distressing, but the good news is most of them are treatable. How can you maintain good menstrual hygiene? An essential question that every menstruating individual should be able to answer confidently. The first step to maintaining good menstrual hygiene is to always use clean menstrual products. This seems like common sense, but it's worth repeating. Whether you prefer pads, tampons, menstrual cups, or period underwear, make sure they're clean before use. Remember, your menstrual products directly come into contact with your body, and using unclean products can lead to infections. Next, change your menstrual products regularly. The general rule of thumb is to change a pad every 4 to 8 hours, a tampon every 4 to 6 hours, and a menstrual cup every 12 hours. However, everyone's flow is different, so adjust these timings based on your personal needs. Regular changes prevent the buildup of bacteria and reduce the risk of conditions like toxic shock syndrome. On to personal hygiene. During menstruation, it's crucial to wash your genital area at least twice a day with warm water. Avoid using harsh soaps or vaginal hygiene products as they can disrupt the natural pH balance, leading to vaginal infections. Now, let's talk diet. What you eat can directly impact your menstrual health. A balanced diet rich in iron, vitamins, and minerals can help manage menstrual symptoms and ensure a healthy cycle. Foods high in iron such as spinach, lentils, and red meat can help replenish iron stores lost during menstruation. Also, hydrating adequately is key. Drinking plenty of water can help reduce bloating and ease menstrual cramps. Remember, maintaining good menstrual hygiene isn't just about cleanliness. It's about respecting your body and giving it the care it deserves. It's about reducing the risk of infections and complications. And above all, it's about ensuring that your menstrual cycle doesn't disrupt your daily life, but instead becomes an integral part of it. Adopting these practices can go a long way in maintaining your menstrual health. So don't wait till your next cycle. Start today, because every step towards better menstrual hygiene is a step towards a healthier, happier you. When should you consult a doctor about your menstrual health? That's a question many of us have pondered over. Well, let's get into it. One clear sign to seek medical help is unusually heavy bleeding. If you find yourself changing your pad or tampon every hour for several consecutive hours, it's a good idea to consult with a healthcare professional. Experiencing severe pain during your cycle is another red flag. While some discomfort is normal, intense pain that hinders your daily activities is not. Also, irregular cycles could indicate a potential issue. If your periods are frequently missing, coming too frequently, or if the cycle length varies greatly from one period to the next, it might be time to seek medical advice. Importantly, regular checkups are vital for maintaining menstrual health. They provide an opportunity to catch any potential problems early and ensure everything is functioning as it should. Remember, your health is important and it's okay to seek help when you need it. So, why is understanding menstrual health so important? Consider this. Every woman is born with a unique set of biological processes that shape her life in profound ways. Menstruation is one such process. It's a monthly reminder of the incredible ability of a woman's body to create life. But like any other biological process, it can be accompanied by challenges, discomfort, and sometimes even health issues. In the past segments, we've covered the basics of menstrual health, the common problems associated with menstruation, the do's and don'ts of menstrual hygiene, and when to seek medical help. All of these are essential pieces of information that every woman should have access to, and understanding them empowers women to take control of their health and well-being. Understanding menstrual health is empowering because it enables women to recognize when their bodies are functioning as they should and when something might be amiss. It gives them the confidence to seek medical assistance when necessary instead of suffering in silence. It also helps them to make informed choices about their lifestyle and hygiene practices, choices that can greatly enhance their comfort and quality of life during their menstrual cycle. Moreover, knowledge about menstrual health can combat the stigma and silence that often surrounds menstruation. It's a natural process, not a taboo subject. The more we understand it, the better we can support each other through it. It's important to remember that every woman's experience with menstruation is unique. What works for one woman might not work for another. That's why it's so crucial to listen to our bodies and to share our experiences and knowledge with others. In conclusion, understanding menstrual health is not just about managing a monthly cycle. It's about empowering women to take control of their health, to make informed decisions, and to break the silence that often surrounds this natural process. Knowledge about menstrual health is a tool, a weapon, and a shield. It's an essential part of women's health and well-being, and it's something that every woman deserves to have. Let's break the silence on menstrual health. Knowledge is power, and every woman deserves to have that power.